Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis. I have a great guest in the building. We've been speaking for a few times now, and I'm really excited about getting his perspective on digital health. I have Dr. Jhonatan Bringas, physician specializing in public health, business strategy, and digital healthcare solutions. And also, the chief communication officer for Finnish MedTech company NUKUTE, a respiratory and sleep medicine wearable company with a deep development in diagnostics and digital health tools. Dr. Bringas, thank you for being on today. I appreciate it.
Thank you, Corey. Thank you very much for inviting me.
Yeah, absolutely, man. So, before we get started, how about you just kind of tell the audience a little bit more about yourself and kind of what gets you up in the morning?
Coffee. So,
amen to that.
Actually, is my 8-month-old daughter. So I'm a Peruvian medical doctor. I'm an immigrant in the Netherlands, and I started working here already since around 6-7 years ago that I arrived to the Netherlands. And I started from the perspective of medical technology because I was doing some business in the medical side already from my home country, Peru. And I've been growing into the different businesses of MedTech development and innovation for the last years. I've held the positions of medical director, of chief medical officer, and then I migrated a little bit before the pandemic into the digital health, let's say, space. Did a couple of really interesting courses, and then started to really prepare myself and develop tools in the digital health. And I started with cardiac rehabilitation as a telemetric solution, so telerehabilitation. And then I went from there into wearable devices, remote monitoring. And then the pandemic happened, and it caught us all by surprise, and it accelerated the space of digital health. So suddenly many of us that were very busy innovating or developing or implementing, we became kind of like, references for digital health and to speak in different events. And so then I've been migrating to different companies consulting. And in the case of NUKUTE, I am their chief medical communications officer. I also work with Medscape. You've had a really interesting chapter with their chief medical officer, Hansa Bhargava.
Yeah.
So we work together creating the strategies for the online programs, and I'm especially keen on digital health. And I'm very happy to be here today. It's another step in my career, of course.
Yeah, absolutely. So, but what I do know about you is, you are really focused on Latin America and how digital innovation and healthcare innovation can really kind of impact those communities. Can you tell us a little bit about, why you feel like it's important to focus there, and what things are kind of happening? You feel like that it's beneficial.
Well, look. So I started, of course, focused on the whole world. I've been globally based, and I'm still globally based. I'm a global chief medical communications officer. But personally, I'm always involved in Latin America because it's my region. It's where I come from. It's where I feel more identified. So the thing is that when I talk about Latin America, and I had a conversation with a person in the business of digital health before, and we spoke about like the lack of real communications of information coming from Latin America. And it happens to be because we are a region of the world that usually stays a little bit to the side, in the news, on the development, in attention. So it is my duty as a Latin American to put it in the map, to put it on the map and to talk about it, because we have to become relevant. I'm one of those people that when I hear a person say, "You're Latin America, you're a minority," I'm like, whoa, we are more than 500 million. We're not a minority.
Right.
We are a majority in the American continent. And so for us, it's important. And I think many Latin Americans would agree, we have to put it on the map. We have to discuss the matters of Latin America. So that's what I'm doing nowadays. And in terms of health tech, I think that health tech and digital health tech can really help, one, create more access to healthcare that has been a big issue in Latin America. And second, of course, they can also help to increase, increase quality of life, increase healthcare outcomes. Because from healthcare comes a lot of different things. You decrease comorbidities, you increase education. You can really make sure that people can go to school. You can really make sure that people can get graduated. You can really make sure that people increase the entire life structure, in Latin America, that would really push the country up. The countries up. So this is what I'm doing, and I'm really excited about working in this space, talking in all these different forums, and writing also for a couple of magazines. And I'm hoping that this work will have as a result the adoption or the implementation of technologies to make the quality of life of people in Latin America better.
Exactly. And thinking of quality of care, when we think of quality of care, we always talk about, closing the healthcare gap, right? So, what role does digital health play in closing the healthcare gap?
I think that digital health has probably the role of the tool that helps really close it. I think we have to really think about the amount of energy and the amount of resources that would take to implement physical medical infrastructure in all those little rural places, from Mexico all the way down to Chile. Countries like Brazil that are really millions of square kilometers, and just putting in physical infrastructure would demand a huge burden, and also would demand a huge amount of professionals that these countries might not have at the moment. So how do we do to provide healthcare to all those people that are so far from the capital cities or the big cities where healthcare is actually provided? Digital tools are probably the most easy to develop tools, and probably the most easy to implement tools. But of course, there are cases, there are still like big obstacles that we have to go through in Latin America, but that is the role. If we think about telemedicine, for instance, in the moment of the pandemic, when COVID started, and Latin America had already a big problem of healthcare access, it only made it worse. COVID, the amount of patients increased. You had the infected patients, and you have the typical patients that come to the ambulatory services, chronic patients. But the amount of doctors decreased, and it continuously decreased because they were also getting infected, So the personnel at the hospitals was in constant decrease. The amount of supplies and implements were constantly in decrease as well. So the healthcare gap began to become bigger and bigger and bigger. So at some point, authorities, healthcare systems in Latin America, they thought we have to do something that will remedy this problem right now, and just put a patch on it, because it's really, we are at a point of no return. So what they did is they implemented digital health, and it has been working in many countries. Let's call it in silos. So it's not that these are structures of digital health that are very well regulated, that are really accessible for everyone, but they are small ecosystems of digital health placed in some countries or some regions, and in other ones not, that are trying to deliver that health access. I think that the role is that one, but we still need to really stop those silos and create a real ecosystem.
Right. And so where does that begin? Because even I'm only assuming that in here in the States, we do have all of these different technologies as far as, trying to get access of care to people in rural areas like you were talking. But in some of these communities, maybe access to the internet may be an issue. Is that some of the same issues you're seeing there, where, yes, you may have the tool, but does the patient that you're trying to provide services for, do they have all the tools that they need?
That is exactly the problem. One of the problems, at least. When somebody asks me in an interview, what do you think are the most important challenges to defeat, let's say, in order to actually be able to implement digital health in Latin America, the Latin American region? The first thing that I say is connectivity. We really need to enhance it and really make more democratized connectivity in Latin America. Let's think about the usage of smartphones in the Americas. When we talk about the Latin American region, the usage of smartphones is around 40 to 50%, which is very low. And then you see, for instance, countries like Peru, that they have around 12.9 million people using smartphones. But if you just think that the majority of the people in these 12.9 million live in the capital, and then you have some other people living in the big cities, you're still not solving any access to healthcare problem if you're going to try to implement those digital tools for the people that actually don't use the smartphones. So there's a big challenge there, which is connecting the country. How do we connect the country? I don't think it's 100% necessary that everyone uses a smartphone in order to have a connected population. There are other ways to do this. I've seen it in the north of Africa, where they put a little post, where there's a computer or an iPad and a nurse, and then people can go and get checked there. There are always ways to do this, but they need connectivity. They need access to the internet, and that's something that they don't have. So that's my number one, definitely. And then, of course, regulation. So the thing about the Americas that differs, for instance, the United States from Latin America, apart from all those like economical and connectivity differences, is regulatory. So the US, they have already a very, let's say, comprehensive regulatory system in terms of digital health. They have FDA regulations, they have software as a device regulations, they even have a digital therapeutic regulation on its own. They classify it very, very concisely, and they know which one is going to be accepted, which one won't. You have to present clinical trials, there's a complete process. It's very well divided. And the same thing goes with the practice of medicine. So if we think about telemedicine, we have to have a very clear guideline of how do we use telemedicine, in which moments we do use telemedicine, in which moments we don't use telemedicine. And in Europe and the United States, hospitals have these types of guidelines. So they have these little guidebooks that tells them, hey, this patient has this. Okay, let's give him like a telemedicine consult to triage his situation. And if we see that he can continue the care with telemedicine, we continue with telemedicine. If not, then he has to go to the hospital face to face with the doctor.
Right.
And in Latin America, we need to have those things as well. We need a guide, but we also need regulations. And of course, we need the part of the legal structure, which is also very important, reimbursing mechanisms, the legal and ethical, matters that have to be also discussed and placed on paper so that people know exactly who is liable whenever something happens in a telemedicine consult or from a telehealth perspective, So in the US, you have these digital health attorneys, for instance, that are always like looking into the regulation side, and we don't have those in Latin America. So we also have to develop those types of systems to understand medical ethical connotations of digital health. And then there's, of course, the adoption. That's the third word that I always say. Adoption is very important from the medical side and from the patient side. But from the medical side, at this point, I think that doctors are very keen on their old, let's say, not their old, but let's call it the ways of doing evidence-based medicine, which is great, but the ways of doing medicine from before and not really being adjusted to the fast pace of digital health development. So, for instance, I was speaking with a doctor. I'm not going to say any names here, but I was speaking with a doctor a couple of weeks ago from my home country, and this doctor just finished their master's in medical informatics, and that was already for me impressive, a Latin American doctor. But then we were speaking about remote patient monitoring for pregnant women and pregnant women of risk, and how it can actually help prevent and monitor treatment of these women, decreasing, maternal fetal mortality. And the first thing that I get is like, there's not enough systematic reviews to validate that idea, And I think, well, that maybe there's not enough systematic reviews because we are really at a fast-paced technology development. So you have to read individual, research is being published, not really systematic reviews. It's very difficult to do that.
Right.
And second, so that's one thing. If the reason of this belief is an issue of adjusting to the acceleration of tech development. They are used to these types of pace, and from the previous time when everything has to be scripted in guidelines and it takes years, and then these new times, they actually just go in a really, really fast pace. And from nowhere, you realize like, oh, okay, this technology is already being used in the Netherlands by Lucy, in the United States by Baby Scripts, and it's been just used in the clinical daily life. They just go really fast from the clinical trial to the practice. That's how we are seeing digital health being implemented.
Right.
So we have to also help them to adopt and to understand the pace. And in the terms of the patients, they have to understand let's say the simpleness of digital health, but also the real power that it has in terms of access, and the real preventative power that it has in terms of really medical practice. This can really help them to prevent so many diseases. It can help them to monitor their chronic diseases better. It can help them be connected to their practitioner, to their provider 24/7. It can make it better. It can make their healthcare better. They have to understand those benefits.
Absolutely. And one thing that I have noticed about when we're talking about adoption, the thing that came to my mind, and this is definitely for a specific population, age population, is trust in the digital tool, because there's an older population that just doesn't trust it, and they would much rather see their doctor in person, regardless of if it's for a cut on their finger or something more serious. If a telehealth visit would suffice, they don't even want to bother with it. They would much rather just come and see the doctor. And that's just, again, a different population of people. I mean, a lot of younger people are just like, yes, I want that, because maybe that they understand that maybe their digital health literacy is a little bit better than someone who's older. But that's, when it comes to adoption, that's one thing that I have noticed. So next thing is, what are some of the changes you see that need to be fixed to make digital health more inclusive?
I think what I said before, connectivity and adoption and regulation. I mean, those things are really more than health tech. When we say digital health, we have to modernize those systems, and we have to make them decentralized. And in order to make the decentralization happen, those three key components: adoption, connectivity, and regulations. Those three have to happen.
Absolutely. So in your article, you wrote an article, the state of digital transformation in Latin American health systems. You talked about, the struggle with access and equity, kind of talk about that. And can you explain a little bit about how health tech is helping and why it's so important to Latin America?
Well, I mean, first of all, in that article, I did mention not only the struggles, but also the developments that are happening in some countries. So I would like to first start by saying that we cannot only focus about the struggles. We can focus about everything we've gained so far in Latin America in the last year and a half since the COVID pandemic started. And for instance, we have implemented digital health in a historic way. Yes, a little bit slower than the US and Europe, but we had no development of digital health until that point. So developing this type of, or a very small development, developing to that level has already been an advancement of the, in general, of Latin American health systems by many years in a very, very short term. Second, some other countries in Latin America have really developed amazing regulatory systems so far. And also they have rolled out great digital health programs. Let's say Argentina is one of those countries, Uruguay, Chile. And we also have to recognize that these countries are right now at the forefront of in Latin America in terms of the development, the adoption, and the regulations on digital health. So it's important to recognize those things, and I wrote about them as well. because I want to emphasize in how these countries are doing it, what is the innovation, where is it coming from, and how the other countries in Latin America could emulate these types of innovative ways of doing and implementing digital health in these other countries' ecosystems. Now, what we have and what it means in tech, for instance, tech means a lot. Tech means, enhancing medical practice. It means decreasing the inaccuracy. And when we talk about precision medicine in these years, and we talk about the development of precision medicine, we have to aim to it. Countries like Latin America, they have to aim to it. So adding more technology of course, in a smart way. We're not just going to add technology to add technology, but adding technology to get the right data, adding technology to use that data to prevent or to treat better or to monitor. Those can actually really help in terms of the development of precision medicine. And in terms of COVID, what they could do right now with the whole pandemic situation and for the future is really helping to decompress the health care system that in the Latin America that is right now in a very, let's say, in very tight position with the amount of people coming every day and the amount of personnel that they actually have. That struggle can really be relieved a little bit by the tools of digital health.
Absolutely. And I know you really, you have a pride for Latin America, and it definitely shows. But you also, like you said, you have experience with globally. With a lot of the innovations and tools out there in digital health, what are your thoughts on, or are there tools out there that are taking into consideration maybe cultural differences, right? Like there are is that something that can be implemented into a digital tool? Like, what does that look like?
Oh my gosh. So I love this question, and I love the questions about equity, because we immediately come to the realization that development of tech is not really done with everyone as a mold. Let's think about, for instance, PPG, right? PPG is also called photoplethysmography. It's just the technology that allows you to monitor your oxygen saturation on your finger. That little pulse oximeter that has that technology. It's a LED light and a camera, or infrared light and a camera that detects microvascular passage of blood, and it can algorithmically assess, for instance, saturation of oxygen or heart rate or respiratory rate. But it was created not taking in consideration pigmentation, So when we think about one of the biggest problems that we've had in coronavirus during this pandemic time is that when we monitored colored people, we had inaccuracy in their saturation levels, especially when they were in crisis. And that originated in many emergencies, many hospitalizations, and many deaths. So that is a very crucial point to just talk about. And I know you're talking about culture, but I just really wanted to bring ethnicity as well.
Yeah.
Because all these factors are very important when we are developing technology. And I can tell you many other cases of many other types of developments that really prioritize groups, or of course, it's not intended, but it is just the way we have done clinical trials in the past. It's the way just the development and the test subjects have been selected in the past, making it not really democratized or decentralized. And there are now solutions in terms of digital health that actually assess those problems and increase the heterogeneity of test populations. For instance, decentralized clinical trials, also called DCTs. I was in a group of professionals that still exists and no longer part of the leadership team, but one of the advisory board members of our startup is Craig Lipset, and it's basically it's called the Decentralized Trials and Research Alliance, and it's an alliance of like pharma companies and clinical research organizations and MedTech companies, institutions, the FDA, universities, all together, trying to leverage the adoption of decentralized research and decentralized trials. And What that does is that it allows us to be able to have a more heterogeneous group of populations, talking about ethnicity variability or diversity in clinical research. And this is really important if we want to develop tech in the future that fits everyone. Now, going back to the cultural part. I'm so sorry. I just start talking and
no, that's great. That was great.
So about the part of culture. So the thing about culture is that, as you said it before, many different populations have different cultures in terms of going to the doctor, when to go to the doctor, if you actually go or not, how to treat your chronic diseases regime. You know, do you adhere? Do you not adhere? Do you believe in the medication or not? And of course, many other things that come in parallel to medicine, which you probably have heard of before, which is the typical, let's call it Creole type of medicine that happens in many different cultures, and that kind of like wants to patch medicine, but what it does is actually makes it worse in some cases. So, you know, and we have to really be mindful of these cultural differences whenever we decide to develop digital technologies. If we think about digital therapeutics right now, for instance, I think that's one of the most promising areas of digital health, for the reason that we are actually treating a disease, let's call it a complementary package of treatment, which is a digital compound that goes next to medication. But this digital compound, it really takes care of behavior. And it really enhances the part of behavioral science. And behavior and culture are very interrelated, because the way you behave, it has really a lot to do with your culture. You know, with the rise of artificial intelligence, being able to actually understand and study every case in an individual way, you know, historically, and per se understanding your behavior, then we can actually be able to predict, to prevent, or to treat disease in a way that is more democratized and more patient-centric. And we don't really have to then apply the same principles for everyone as it has been done before in just the practice of the conventional medicine.
Right. Do you feel like, thank you for that answer. Do you feel like having that information from a physician, from a provider perspective, will that also allow you to maybe understand your patient a little bit better? Because, you know, there are those times where the patient may not feel like their provider knows what, like, really understands them, or is maybe treating them fairly, or whatever the case may be. Do you feel like some of these cultural differences and trials with, you know, getting more diverse populations, what kind of effect will this have on the provider to maybe have a little bit more empathy to that patient?
I think it will have a tremendous effect. You know, being able to see the data and see how disease behaves in every people differently, understanding their behavior, understanding their history, it really can help you understand patients better. Also, I think that in medical education, there is maybe a little bit of an opening there for something cross-cultural in studies. I think it will be really great for the practice of medicine. We don't even have it in Latin America, to be honest, that might be something that people want to go and look into. If we want to go into the 21st century and think that we not only have cultural differences, or, you know, religious differences, et cetera, et cetera, et cetera. All these things, they have, you know, different connotations. For instance, if you think about diverticulitis and happening in the right side in Asians, you know, very more often than in white people. And I saw it in a chapter of a TV show the other day. I was just thinking that this is completely true. It's the same thing that goes with people from Latin America are more propense to diabetes, and same as African Americans. We have to then be able to be more mindful when the patient comes and tells you, hey, you know what, I almost fainted, and I think there must be something with my sugar, you know, blood, they call it sugar, glycemia. And then as a doctor, you have to realize, okay, well, this is a population that might, you know, be in a higher risk than these other ones. So I might as well just check. And I think those things will come. But the usage of artificial intelligence and data for the daily management of disease will really help out as well into understanding the individual case way better. And of course, this is what a lot of doctors are speaking right now in terms of precision medicine.
Right, right. And even I read somewhere, you even seeing more patients are wearing wearables, like to monitor their physical activity and things like that, to have that constant. If there's one thing that I've learned about doctors with working for them for the past, however long I've been working as a in a clinical setting, nothing matters but the data. What does the data show me? And I'm sure you could appreciate that. Is if there's no data, how can they make the appropriate, so get this appropriate solution to them? So I think the more and more we see these wearables and getting this exact data for the provider, it can help you as the provider make the best decision, and also help the patient really know where they're at with their care as well and what they're doing for themselves.
Definitely. I love what you just said about the wearables, by the way. It's something that I'm always saying in a lot of different spaces. I think the wearables are really here to stay. They are great fountains of data, sources of data. They are doing a terrific job in accumulating data. And now there's really interesting research happening, for instance, with the Apple Watch and the Fitbit against the conventional ECG to see the accuracy of heart rate. We're talking about 91 to 95% accuracy. That's really impressive, And if we think about heart rate and respiratory rate, we can already do a lot with those. Of course, we're not talking about diagnostics, right? Diagnostics is different. We need really medical devices for that. But we can do screening. We can do prevention. We can also do monitoring. If we have a patient and we see that the patient is, we give them a new medication, let's say salbutamol for the asthma, and then it starts to have tachycardias, we can see it on the Apple Watch, so the patient can actually record and show it to the doctor. And it would be, I think the doctors have to really also see these researches being happening and understand that, okay, these are wearables, they are consumer wearables, but they're giving me information and it might help me in my clinic. And that it might really give me some more feedback. At the end of the day, they are asking the patient, have you had palpitations? If your Apple Watch is telling you that they had a tachycardia and the patient says, yes, I had palpitations, with them, bingo, we have a secondary effect from your medication. Let's see what we can do about that. And those are the things that wearables can really help us do.
Right. Instead of that patient depending on their culture and ethnicity, waiting until it gets way worse. Right. Because some people are afraid to go. So they may have issues not going to the hospital because in their mind, if I go to the hospital, I'm going to die. So they wait until they're about to die, to go to the hospital. So yeah. I think I agree with you. I think it definitely helps with not only prevention, but being able to nip it in the bud before it gets too bad for sure.
It empowers the patient. For
Empowering,
sure. It gives
absolutely.
them insight into their healthcare. Yes.
Yep, that's a great word. So, if you had your way, Dr. Bringas, in a perfect world, and whatever everything that you've been doing in digital health, prevention, public health, all the things you've been doing globally, if success was guaranteed, what would the health system look like in your eyes?
Oh my gosh, that would be a dream. Well, I mean, first, democratize healthcare. That would be something that I really would love to see. Everyone has access to, from anywhere they are, to healthcare. They can, of course, what we just said, they can be empowered and they can monitor their own healthcare, look for help whenever they need it, prevent complications and monitor their chronic diseases. But also they could travel the world. They would be able to share their medical data everywhere where they are. that medical data is completely compatible with whatever they have in that country, so that the doctor in Saudi Arabia, from the patient that came from Canada, can see the patient and still can access all those levels of information, understand who this patient is, and give them the best medical care. I see, if you tell me what the future is, and I can already see it in my head, like you are getting out of this futuristic plane, and you're not feeling very well abroad, and you just go to your doctor, you have a wearable, you have an RFID chip there that you just logged somewhere, and then all your healthcare data comes into this doctor's computer, and they can really understand, what you've been feeling. There's tons of data, but very well, and let's call it human-centered design, so that the doctor can really, in the look of one, in 1 second look, they can already see the trends and what's going on with you and give you the right medical care. I think that is a dream that I have sometimes awake. I'm just thinking, this is what I'm working for right now. And one day it will happen, and I'll say, well, I was in that space in the moment that it started. And this is a little bit, maybe in 0.0001% is my victory as well.
Awesome. We'll see it one day. One day you're gonna make it happen.
We'll see.
Well, Dr. Bringas, thank you so much for being on the podcast with me today. I really appreciate it. If anybody listening wanted to get a hold of you and learn more about what you're doing and kind of where you're at, where can they find you?
I'm usually on Twitter. My Twitter address is at it's at jbringasmd. And then I'm also posting a lot on LinkedIn. But basically, if they go to Twitter or LinkedIn, they can always just send me a message. And if you have any questions or would like to have a collaboration or just some information, my DMs are always open. And I love to respond to as many questions as I can.
Awesome. Well, again, Dr. Bringas, thank you so much for being on the podcast today. And everybody, thank you for listening. I'll holler at you next time.